Time for your senior segment, and Dr. Iribarren joins us. Good to see you as always.
I'm glad to see you.
Now, you said today we're going to be talking about asbestos. Kind of talk about how that's a problem, especially these days.
Yeah, well, everybody have heard about asbestos or asbestos-related health issues and lung diseases. Asbestos was a major issue a few years back, especially because it has been used for so many years in constructions, especially old constructions from the 40s, 50s, 60s, even up to 70s. And so it was widely used as an insulating material, but also as a construction material. So a lot of people that work during those years, electricians or people who work in constructions and so for remodeling or tearing buildings down, were exposed at some point or to asbestos. But not only that, but also their family members, wives that that got the clothes or cleaning their clothes and were directly related to them were also they're also considered exposed to asbestos. Okay, so it is a major issue because it creates a lot of health problems, especially related to lung issues. Okay, when somebody is exposed to asbestos, there are four things that could happen. Number one, they can develop what we call asbestosis. Asbestosis is predominantly scarring of the lung. Silent for many, many years. We actually detect those diseases 20 or 30 years after the exposure was done. So patients who work in the 70s now is when we're seeing the disease. Okay, and that's the key about it. It takes about 20 to 30 years to develop. All right.
Now, I know you were talking about people in construction, but what about maybe somebody who worked in a building and there was asbestos in that building?
Yeah, so you have to have a significant exposure for a significant amount of time. So if you were just exposed one time for couple hours or a couple days, that really is not considered a significant asbestos exposure. You need to be consistent for several weeks or even months to be exposed to asbestos. Okay. Now, some of these diseases obviously can present with worsening shortness of breath, chest pain, coughing, wheezing, and so forth. So they can present like that, but the vast majority of them come in with completely asymptomatic.
All right, doctor, thank you so much.
All
and of
right.
course, they can visit you at the Lung Center.
Okay.
We appreciate that
All
so
right.
much.